Hi everyone, welcome along to this Nature Sunshine UK presentation on vitamin D3. My name is Emma Whitnall and I'm going to be taking you through the training today. Most of us will commonly know vitamin D as the sunshine vitamin because it is indeed the only vitamin that is created in our body from exposure to sunlight. It is a very essential part of many metabolic pathways within the body. And what we're discovering about the function of vitamin D is that it has more of a hormone-like function within the body. It is really hard to get vitamin D from the daily diet, and so supplementation is actually very well recognized within the medical world to be part of a healthy daily nutritional practice. Let's take a look at the biochemistry of vitamin D because it is a little bit complex. There is in fact a plant source of vitamin D, which is called D2. Now this is not as bioactive within the body as D3, which is the active form in animals, and this is the form that is made when we're exposed to UVB sunlight rays. Once vitamin D is synthesized as a result of sunlight exposure, it then gets converted in the liver into a pre-hormone substrate called 25-hydroxy vitamin D. And this is the biochemical marker for vitamin D status within the body. So if you ever got your vitamin D levels tested through your GP via a blood test, this is the version they would be looking at. Then 25-hydroxy vitamin D goes on to be further converted in the kidneys to make 1,25-hydroxy vitamin D, which is also known as calcitriol. And this is what's responsible for calcium absorption into the bloodstream, which can then obviously be taken up for bone health and structure. And it is well documented how important vitamin D is for bone health. So if there is deficiency within a developing fetus or the infancy stages of life, whether that be a deficiency from mum or within the baby itself, this will lead to rickets, which is a deformation of the lower limbs, and other bone dysfunctions can come about as well. And this is because calcitriol, or the 1,25-hydroxy, is responsible for helping calcium to be absorbed into the body. And calcium is the main mineral required for bone structure and health. But it's not just about bone health. When we look at vitamin D, there are so many other aspects of health that are really heavily implicated. Dr. Robert Heaney is an extensive vitamin D researcher, and he is a functional medicine doctor, and he's based at the Creighton University in Nebraska. He has dedicated his life's work basically to vitamin D research and describes vitamin D's role in calcium absorption as just the tip of the iceberg in terms of its role within the body. And actually, what the research is suggesting is that inadequate levels of vitamin D will manifest very differently depending on the person, depending on the population. So it can be very hard to judge whether somebody has the right levels of vitamin D for them just on a mainstream blood test. According to Dr. Heaney and the Vitamin D Council, deficiencies and insufficiencies of vitamin D are implicated in things like type 1 diabetes, multiple sclerosis, rheumatoid arthritis, inflammatory bowel disease, which, if you understand the common threads between these conditions, is autoimmunity, cardiovascular disease, rickets, as we've already noted, other bone issues like osteomalacia, osteopenia, which is like a precondition to full-blown osteoporosis. And in pregnancy, vitamin D deficiency can be tied into preeclampsia as well. Here is a more extensive list from the Vitamin D Council website looking at the various conditions that have been implicated in vitamin D deficiency. So you can see that's quite a big list. Let's look a little bit more at rickets now, because rickets is something that we considered to be a disease of the past, really, because once we figured out it's vitamin D that is responsible for preventing rickets, we thought that this would never be an issue again. But actually, countries which do get very good sunlight levels, such as New Zealand, Australia, we're seeing very recent rickets cases. So this was a study that was done in New Zealand between the years 2010 and 2013, and they approached about 92% of New Zealand's paediatricians countrywide, and they were asked if they'd come across any rickets cases, and there were 38 paediatricians that reported 73 cases of rickets. As the research went on, they excluded cases that didn't quite meet the strict clinical definition of vitamin D deficiency rickets, but that still left them 58 cases with the disease. Not just bone issues in children, but in adults as well. This study is also published on the Vitamin D Council and looked at the relationship between vitamin D deficiency and stress fractures within military personnel in the US. And they found that the average levels of vitamin D with those that got stress fractures was significantly lower than those military personnel that didn't. So let's take a look now at vitamin D, the parathyroid hormone, and calcium, and what is the relationship between these three things? Well, calcium, as we know, is required for strong and healthy bones, but it's also essential for keeping us alive. Our blood levels of calcium are absolutely vital for keeping our nervous system balanced, for keeping our heart beating and pumping blood around our body, and to keep our muscles working and functioning as well. Now, our bones are essentially a great resource for calcium within the body. And so if the levels of calcium within our blood fall below a healthy level, our body is going to kick in hormone responses and various metabolic responses to right this wrong, if you like, to rebalance the system. And it will do that by drawing down on calcium that is stored within the bones. Because at the end of the day, our body always prioritizes survival over anything else. And if we get weak bones because we haven't got enough calcium in there and we end up fracturing ourselves, that's not necessarily life-threatening. Whereas if we don't have enough calcium in our bloodstream to keep our heart beating, to keep our nervous system firing, our brain functioning, then that is very life-threatening. So this whole balance and relationship between blood calcium and bone calcium is all governed by vitamin D, or calcitriol, so active vitamin D within the body, and the parathyroid hormone. Now, your parathyroid is a set of 4 tiny little glands that sit in the neck area, pretty much has just one main role in the body, which is to keep the calcium balance. And here's just a quick diagram to show you that. So when blood levels of calcium are low, that stimulates the parathyroid gland to produce the parathyroid hormone, which will either tell the bones to break down calcium and release that into the bloodstream, or it will talk to the kidneys to hold on to not excrete calcium through the urine. Vitamin D also plays a role in the kidneys to do this. And it will also tell the intestines to absorb more calcium where possible. All of these 3 things work together to increase blood calcium levels, and that keeps our heart beating, our brain functioning, and keeps us alive. So we can see if vitamin D is deficient or insufficient within the body, it's very hard to A, keep good levels of calcium within our bones, and B, keep good levels of calcium within our blood system as well. So how about the correlation between vitamin D and mood disorders? Because this is something that has been extensively studied of late. And this particular study, which is also found on the Vitamin D Council website, shows that patients with mood disorders, i.e. major depression and bipolar disorders, have shown to have lower vitamin D levels than those people with schizophrenia, which has also been historically linked to vitamin D deficiency. And you only have to think about some of the anecdotal symptoms that people report as a result of seasonal affective disorder, so SAD, in countries like the UK and other places that have really long winters and not a lot of sunlight exposure. These people report low mood, lack of energy, low motivation, and these sorts of things, which may all be connected to vitamin D insufficiencies within the body. And finally, vitamin D levels have also been looked at in relation to breast cancer prevalence. This particular study looked at Korean women and found that vitamin D deficiency increased the odds of developing breast cancer by 27%. So why are the functions of vitamin D so diverse within the body? How can one nutrient be so prevalent across an array of systems and functions? Well, according to Dr. Heaney, every cell in the body actually relies on good levels of vitamin D, and this is in order to unlock the DNA or the genetic information within each cell. And we know that our DNA is a recipe for the outcomes that we get, and the expression of every gene in the body requires vitamin D. It is estimated that around 10 million people across England alone are deficient in vitamin D, and that is according to the National Institute for Health and Care. Low levels of vitamin D in the UK are most likely due to poor sunlight exposure. Because, as we know, the most natural source of vitamin D is sunlight, is getting those ultraviolet B rays onto the skin. But during the months of October through to April in the UK, the sun is never at the right wavelength to stimulate synthesis of vitamin D within our skin. Therefore, supplementation of vitamin D, particularly through the winter months, is really something everyone should consider. Some people are more susceptible to vitamin D deficiency than others, including women who are pregnant and breastfeeding, infants in particular if mum is deficient, children, elderly, people with darker skin, people who have no or low sunlight exposure, particularly as we've already said in the UK or Northern Europe. But even really sunny countries such as New Zealand and Australia are seeing vitamin D deficiencies. And this is most likely because initiatives to stay out of the sun and cover up. So what exactly are optimal levels of vitamin D within the body? So looking here at this chart, we're looking at 25-hydroxy vitamin D, and that is measured in nanomoles per litre of blood or nanograms per milliliter of blood, and that depends on which country you're in. Here in the UK, we use the nanomoles per litre reading. So for sufficient levels, you're really looking at anything between 100 and 250 nanomoles. Anything below that is heading into the insufficient and deficient categories. And it's been reported that toxicity levels of vitamin D would not actually kick in until you hit above 375 nanomole per litre. As I've said, you can get your blood levels tested, so you can look at your 25-hydroxy D3 levels by requesting a blood test from your GP. And if you find that you are insufficient or deficient, the dosage of supplementation that you would take is dependent on the level of deficiency that you've begun at. And for full details on dosages, I would certainly consult the Vitamin D Council website. They've got very detailed information on how you can dose up. But here's just an example. So if you've found that your vitamin D levels are insufficient, i.e. they're sitting between 50 and 75 nanomoles per litre, depending on your goal, so if you're looking to increase those levels to 100 nanomoles per litre, the recommended dosage is 2,000 international units a day until you reach your 100 nanomoles. If you're aiming to get up to the 175 nanomoles, which is smack bang in the middle of the optimal range, then you could be dosing up to 8,600 international units a day, again until you reach those levels. It really is very dependent on your vitamin D status as to how much dosage you give. Now, Nature's Sunshine's vitamin D3 is an absolutely perfect place to start for vitamin D supplementation to prevent vitamin D deficiency or start to remedy a deficiency that you may have detected. Each tablet provides 2,000 international units of the bioactive form of vitamin D, which is D3. If you have got blood tests to work from, you can use that information plus the information contained on the Vitamin D Council site to personalise the dosage as required. But generally, 2 tablets during the winter months or 1 tablet at any other time is ideal. However, it is a good idea to use blood tests, and then you can use personalised dosages. So in summary, vitamin D3 is very, very important for the healthy functioning of all cells within our body. And because of this, optimal levels are implicated in the healthy balance of all systems. But in particular, the immune system, our glandular and hormonal systems, and our skeletal systems are very heavily reliant on good levels of vitamin D. Everybody in the UK should supplement with D3 at least throughout the winter months, and as you've discovered, dosages are dependent on individual needs. But the Nature's Sunshine D3 recommended dose is 4,000 international units, which sits very comfortably in the recommended ranges for supplementation by the Vitamin D Council. So, thank you very much for tuning in and listening to this presentation on vitamin D3, and we very much look forward to you joining us next time.